Hey everyone, welcome back to Bewitching Brain. My name is Joyce Lee, and I'm a rising M2 at the Medical College of Wisconsin in Milwaukee. We're so happy to have you back, and we encourage you to subscribe and share. Remember, take good care, be safe, and help others be safe. In the last video, we talked about the brainstem structure and function and introduced cranial nerves. In this video, we will explore the cranial nerves in more detail. There are 12 pairs of cranial nerves, abbreviated as CN, and they are labeled here on the image to the right. These pairs are symmetrical and innervate the respective half of the body. Some of these cranial nerves are purely sensory, others are purely motor, and the remaining cranial nerves have both motor and sensory functions. For the remainder of the slides, I'll be highlighting purely sensory nerves as blue, purely motor nerves as red, and mixed sensory and motor nerves as purple. The first set of cranial nerves 1 through 4, are located right above the brainstem. Cranial nerves 1 and 2 are purely sensory, while cranial nerves 3 and 4 are purely motor. The first cranial nerve is the olfactory nerve, which is purely sensory, as it is responsible for the sense of smell. The nerve lies right beneath the rectus gyrus of the brain and lies on top of the cribriform plate of the ethmoid bone. Fracturing of this plate leads to anosmia, or the loss of sense of smell. The second cranial nerve is the optic nerve. It is a sensory-only cranial nerve, and it is responsible for our eyesight. The nerve lies on top of the sphenoid bone on the cranium and enters the optic canal and into the orbit. Damage to any part of the optic nerve, chiasm, or tract leads to visual field defects. Cranial nerve 3 is the oculomotor nerve, which is a motor-only cranial nerve. It is located medially right above the pons. It travels through the superior orbital fissure of the sphenoid bone and enters the orbit. It innervates the levator palpebrae superioris, which raises the eyelid. Additionally, it innervates most of the extraocular muscles to move your eyes, the superior, inferior, and medial rectus muscles, as well as the inferior oblique muscle. Cranial nerve 4 is the trochlear nerve, which is also a motor-only cranial nerve. It is located laterally right above the pons and travels through the superior orbital fissure of the sphenoid bone along with the oculomotor nerve to enter the orbit. The nerve solely innervates the superior oblique muscle of the eye. The next set of cranial nerves, nerves 5 through 8, are located at the pons, which is CN5, or the pontomedullary junction, which are nerves 6, 7, and 8. CN6 is purely motor, CN7 is purely sensory, and CN5 and CN7 are mixed motor and sensory. Cranial nerve 5 is the trigeminal nerve, which is both motor and sensory. It is the thickest cranial nerve that originates from the pons and has a large ganglion that further divides into 3 branches. These branches are V1, the ophthalmic branch, which is purely sensory, V2, the maxillary branch, which is also purely sensory, and V3, which is the mandibular branch, which is mixed motor and sensory. Here's a table that details the functions of each of these 3 branches of the trigeminal nerve. V1 gets sensory information from the anterior scalp, forehead, tip of the nose, the orbital region, and the upper nasal cavity. It travels through the superior orbital fissure in the sphenoid bone, along with the oculomotor and trochlear nerves to enter the orbit. V2 gets sensory information from the upper lip and cheekbones, lower nasal cavity, maxillary sinus, palate, and upper teeth. It travels through the foramen rotundum of the sphenoid bone. Finally, V3, which has both motor and sensory functions, innervates the muscles of mastication, the tensor veli palatini, tensor tympani, mylohyoid, and the anterior belly of the digastric muscles, as well as receives sensory information from the lower jaw and temple region, the front 2/3 of the tongue, and the lower teeth. The nerve travels through the foramen ovale of the sphenoid bone. Cranial nerve 6 is the abducens nerve, also sometimes called the Abducens nerve. This nerve is motor only and is located medially in a pontomedullary junction, which is the space located between the pons and the medulla, shown by the dashed red line in the picture. The nerve travels with the oculomotor, trochlear, and V1 of the trigeminal nerve through the superior orbital fissure of the sphenoid bone to enter the orbit. The nerve solely innervates the lateral rectus muscle. The next nerve is cranial nerve 7, or the facial nerve. This CN is both motor and sensory. On the brain, the nerve can look more like one nerve joined together, as shown in this diagram, located lateral to the abducens nerve in a pontomedullary junction. The nerve travels through a number of different foramina in the skull: the internal acoustic meatus, the facial canal, and the stylomastoid foramen of the temporal bone. The motor components of the nerve further branch into 5 nerves: the temporal, zygomatic, buccal, marginal mandibular, and the cervical nerves. A helpful mnemonic is "To Zanzibar" by Motorcar. These nerves go on to innervate facial expression muscles: the stapedius, the stylohyoid, and the posterior belly of the digastric muscle. The facial nerve also receives sensory input from the area near the ear and special taste information from the front 2/3 of the tongue via the chorda tympani nerve, which is one of its branches. The 8th cranial nerve, or the vestibulocochlear nerve, is sensory only and is responsible for hearing and balance. It is located lateral to the facial nerve at the pontomedullary junction. It travels through the internal acoustic meatus of the temporal bone with part of the facial nerve. The last set of cranial nerves, nerves 9 through 12, are located right below the pons on the medulla for nerves 9, 10, and 12, and the midbrain, which is the CN 11. The purely motor nerves are 11 and 12, and the mixed motor and sensory nerves are 9 and 10. Cranial nerve 9 is the glossopharyngeal nerve, which is both motor and sensory. It originates from the lateral side of the medulla and it travels through the jugular foramen. The nerve innervates the stylopharyngeus muscle, receives sensory information from the back 1/3 of the tongue, the soft palate, and pharynx, and it also receives taste information from the back 1/3 of the tongue. The 10th cranial nerve is the vagus nerve, which is also both motor and sensory. It originates from the medulla right below CN9 and travels through the jugular foramen. The vagus nerve innervates the soft palate muscles, except for the stylopharyngeus, which is innervated by CN9, and the tensor villi palatini, which is innervated by V3 of CN5. The muscles that this nerve innervates are the pharyngeal constrictors, levator villi palatini, salpingopharyngeus, palatopharyngeus, palatoglossus, the cricothyroid, and larynx. The nerve also receives sensory information from the pharynx, larynx, external ear, ear canal, external tympanic membrane, and the meninges around the posterior cranial fossa. It also receives taste information from the epiglottis. Cranial nerve 11, or the accessory nerve, is purely motor. It originates from the midbrain, inferior to CN 9 and 10, and climbs up the medulla. The nerve enters the skull through the foramen magnum before exiting the skull through the jugular foramen of the occipital bone. The accessory nerve innervates the sternocleidomastoid and trapezius muscles. Damage to a nerve can lead to weakness in turning the head to the side or when shrugging shoulders. Finally, the last cranial nerve 12, or the hypoglossal nerve, is also purely motor. It originates from the medulla between the medullary olive and pyramid. The nerve travels through the hypoglossal canal of the occipital bone. It innervates the intrinsic muscles of the tongue, as well as 3 of 4 extrinsic muscles of the tongue: the genioglossus, hyoglossus, and the styoglossus muscles. Injury to your nerve could lead to the tongue deviating to the same side of the nerve injury. A good way to remember this is that the tongue would lick the wound. After briefly telling you about what each of these 12 pairs of cranial nerves do, I made a short summary table that quickly shows which cranial nerves are purely motor, purely sensory, or a mix of both. First, I want to thank Dr. Teresa Patitucci for sharing her awesome drawing of the base of the brain with us. Next time, we'll be kicking off a new series on blood, CSF, and meninges of the brain, starting with the blood-brain barrier. Thank you for listening, Brainiacs. Please subscribe to us and tune in next time for more. Don't forget to continue training your brain, including memorizing these cranial nerves. Until next time, bye.